The COVID-19 pandemic has left many people in Boston with serious hardships, from illness to unemployment and food insecurity, along with anxiety about housing and immigration enforcement. On the front lines responding to those concerns are a number of grassroots organizations being supported by the Massachusetts Redistribution Fund. To tell us about the fund's efforts is a member of its advisory board, along with being the lead coordinator at Neighbors United for a Better East Boston, Mota. Thank you very much for being with us, Gloribell.
Thank you, Chris. Thank you so much for the invitation and letting us share a little bit more about the fund and what we're doing to respond.
Gloribell, there are groups that are receiving money from the fund and helping people in the neighborhoods. Some of them have been around for quite a long time, but what is it about these groups that's special?
Well, I mean, I think when the conception of the Redistribution Fund, we knew, and a lot of these groups had already been working with some of the, the majority of the communities that were going to be highly impacted, highly vulnerable. We're not probably going to be able to have access to even the services that the city or state or even national were going to provide, and wanted to figure out. And when we heard there was going to be a relief package, and decided that it would be good to be able to strengthen these organizations that already have a relationship connection and have been building on organizing and grassroots community organizing on the local level to support them during this crisis.
I'm trying to imagine some real worst case scenarios you might be dealing with. Some family that might be confronted with illness, unemployment, they can't get benefits, and they might not have health coverage. Are you helping people like that?
Yeah, so we're fortunate with New Bay, and we're based in the neighborhood of East Boston, which is an island, and it's also part close to, Chelsea, neighboring the Chelsea area, where highly central South American immigrants. And what we've seen here, and I could speak on this experience, is that those that were already vulnerable in the shadows were further in the dark during this pandemic. We had a case where, we have a case right now where a single mother with two children, one child is asthmatic, and her 16-year-old child is positive. But because of the way that we live in our housing, there is not really opportunity to isolate. So how do we isolate and make sure that those that are impacted? That's why we've seen a huge impact of those that were tested positive for COVID in the East Boston, Chelsea, this region area. And so we've seen a lot of cases of needs for isolation, but not being able to do it because of overcrowdedness of homes. We've seen needs. Most of the folks that we've been serving have lost their jobs because of restaurants that do not qualify for unemployment or did not receive a stimulus check, even if they had U.S. citizen children. So it's been like a mix of dealing with the emotional fallout because of the health crisis and the loss that families are feeling, the economic fallout because of the uncertainty of how to pay their next bill or if they're going to be able to keep their home, and also what the future and lies for them now that. So those are just a few examples, but I think throughout we've seen particularly communities of color, the Black community, been impacted, access to testing. So in responding to that, that's not what the fund, we can't respond to that. That's actually, but because of these organizations and the work that they do, we're able to respond in a way that also allows us to make sure that we support movement policies and ensure that our local governments are being responsible to our communities.
It occurs to me that if you have a large household, they're vulnerable to infection, they need more, some places where they can go and isolate. It's not just a question of resources. They need somebody who can advocate for a change of policy, don't they?
They do, and I think that's part of, the first three, when COVID hit, everyone was like, I've never experienced first pandemic in my lifetime. And it was like, how do we respond? How does the city respond? And hoping, right, that you know, our leadership would be able to respond in a way that, but we knew that there were going to be gaps, whether it was language barrier, whether it was technology barrier. We saw everything go online, and many of our families not having access to technology or being able to fill out, you know, an online form if they were qualified for unemployment or they qualified for SNAP. So, you know, these little things, like, they're not little things, these gaps that we were seeing, some of these organizations were filling in on the ground, in the front line, building mutual aid networks, working on policy to ensure that there was a 3-month mark. You know, City Life was, you know, working on these policies to ensure that, you know, there wasn't going to be massive displacement, ensuring that resources and direct relief was going to go to those that weren't going to get a stimulus check. So that's kind of like the response that we did, but what is a lot of it is a response that we want to see also, how is the city and the state going to respond to these families through policy.
You just used a term that I've been hearing a lot of only in the past few months, and that is mutual aid. And I've heard a lot of this about East Boston. What does that mean exactly?
So it's mutual aid has been around for long. I think it's a practice that's been beyond and before it was called mutual aid, but really is the concept of community and neighbors practicing reciprocity and sharing with their needs and their abundance. What we saw, we were all isolated, and many neighbors and across the state and put up these mutual aid concepts, and we took it on in East Boston because as an organization, we work very closely, and most all of us live here in East Boston. We live here, we're neighbors, but we don't really, you know, belong to civic associations. A lot of our families, immigrant families, are constantly working, so there's not really like a communal space. So the mutual aid network provided an opportunity to connect neighbors that probably haven't connected before, to be very vulnerable during this time and share what they need, and also offer what they have, and be able to do that directly with one another. So we've seen neighbors be able to buy groceries for their, or diapers if they needed to, or fill out an online unemployment form for someone that wasn't able to, or, you know, just comfort someone that just lost. We have a family that lost her husband, you know, during this, and wasn't able to bury them and memorize, you know, in a memorial, and just comfort. So it was making connections, building a local ecology where neighbors share their struggles and celebrate their, you know, their joys as well.
Well, there are other funding initiatives going on right now. They might even have goals that are broadly similar, but why do you need this particular fund to do, I guess, what's not being done otherwise?
Okay, I guess, yes, right? So there's all these funds coming out. I think we wanted to directly ask the you know, families and households and individuals across Massachusetts to pledge their check, their stimulus check, and particularly to pledge it to fund groups that were already on the ground working with families that were, you know, we're seeing the inequities of the communities of colors and low-income families being hit, be able to provide it also for rebuilding in an equitable way. A lot of these organizations have been working on immigrant rights, housing justice, you know, our you know, criminal justice reform. So these are things that have been, you know, we're seeing it, right, with this climate and with the death of Floyd and the Black Lives Matter movement. And we've also started with COVID, that the healthcare system, the inequality and the inequity. So these organizations have already been working, addressing this through policy, through grassroots organizing, through leadership, through civic engagement. And so we want to make sure that they're not lost. They're still, you know, and that's not lost as we recover from the response and COVID. So I think this is what makes this fund a little unique. In a sense, we're all serving, you know, at the end, we're serving the most vulnerable, those that are not getting access, but you're also serving a recovery that would hopefully bring us to a more just and society and better policies for our communities.
Now, isn't the importance of these groups that you're working with also about the trust that they get from people in the community and the fact that these groups know how to reach people?
Yes, I mean, I think they've had a lot of these organizations have had experience and successes in doing and reaching the communities that we want to reach, getting them involved, getting them to be active. So I think, and there's a trust, right? It's not someone just coming in, parachuting into your community. We have deep roots here. A lot of us have lived in the communities that we're serving. So I think that's also a benefit to be able to, we were able through the connections, we started with 30 neighbors and now on the mutual aid EC, and now we have about 300 to 400 neighbors connecting with each other. So, I mean, I think it's that ripple effect of being able to have built the relationships, have the connection, and also have the proven experience to create change.
Well, Gloribell, finally, we should mention that if people want to get more information about the fund to help out or get some help, is there some way they can do that online?
Yes, we have a website. It's redistributionfund.org. You could read a little bit why Grassroots, and you could see who we've funded, and you could send an email if your group or our organization might be interested. We're hearing that there might be another package coming out, depending on how things go, and we want to be prepared to make sure that it continues to reach our families, our communities, and those that most need it.